Hi, my name is Devin Ritchie, and I am an LPN to BSN student at Indiana State University. And today I'm going to give you a presentation about sexually transmitted infections in older adults. First, let's talk about the learning objectives. So, you, as the learner, after watching this presentation, will be able to understand the rates of sexually transmitted infections, or STIs, in the older adult population. You'll be able to understand the presentation and the treatment of the most common STIs, and you'll be able to understand how to prevent STIs. At this time, I'm going to ask that you pause the video and please take the short 10-question pretest that's linked in the description box below. Once you are finished with that test, go ahead and head on back here to the video. So let's talk about some statistics. So in 2016, Americans ages 45 years and older had 82,938 cases reported to the CDC of gonorrhea, syphilis, and chlamydia. And to break down those numbers, for chlamydia, there was about 43,500 cases, which was a 39% increase from 2012 to 2016. For gonorrhea, there was about 34,000 cases, and that was an increase of 52% from 2012 to 2016. And then lastly, for syphilis, there was 5,650 cases, and that was a 44% increase from 2012 to 2016. So as you can see by those numbers, the STI rates are on the rise for older adults. So what puts the older adult population at risk? First, there are some physiological changes that happen as you age. So in women that are past menopause, they have a decreased estrogen level in their bodies, which leads to vaginal dryness. And when the vagina is dry, it makes it easier to contract STIs. Also, as you age, your immune system becomes less effective, making you more susceptible to infections in general, including STIs. There's also some healthcare issues. So, despite sexual activity being completely normal in the older adult population, there's still a stigma around it. And because of that, some providers may be reluctant to discuss STI testing with older adults. There's also psychosocial issues. So some of those include a loss of a longtime partner or divorce, which leads to new or multiple partners. And these older adults may be embarrassed to talk with their providers about their sexual activity or any symptoms they may be having. Lastly, there's a lack of education in some older adults. Some adults, they believe that they are not at risk for STIs. For example, some women believe that just because they can't get pregnant, they don't need to use any type of protection. Some older adults do not think about the risk of STIs just because they know that pregnancy isn't a risk with sexual activity anymore. So now we're going to talk about the presentation or the symptoms in the three most common STIs: chlamydia, gonorrhea, and syphilis. So with chlamydia, there's typically no symptoms at all, but some of the symptoms, if you do have them, include pain or burning while peeing, painful sex, abnormal vaginal discharge, a pus or watery milky discharge from the penis, painful or swollen testicles, lower abdominal pain, and pain and or discharge around the anus. Similar to chlamydia, gonorrhea doesn't always cause symptoms, but if it does, again, some of those symptoms are pain or burning when peeing, abnormal vaginal discharge, which is typically a yellowish or a bloody color, yellow, white, or green discharge from the penis, painful or swollen testicles, itching in and around the anus, discharge from the anus, and pain when having a bowel movement. So last we come to syphilis. So syphilis, again, does not always have symptoms, or with syphilis, sometimes the symptoms can come and go. So syphilis is the most severe of the three because it does have some very long-term side effects with it. There's 3 different stages of syphilis: the primary, secondary, and late stage. So in the primary, the most common symptom is a sore, and this sore can either be firm, round, painless, or it can be open and wet. And this sore can be on the vulva, the vagina, the anus, the penis. Basically, it's anywhere where the syphilis entered the body and where the body became infected. So that sore can go away on its own, but the person is still infected with syphilis. In the second stage, you can get a rash on your palms of your hands or your soles of your feet, and it's difficult to see and it's not usually itchy. You could also have some mild flu-like symptoms, so some body aches, a low-grade fever, and then when you come to the late stage, your symptoms can get really severe. So again, you might not always have symptoms, but you could get tumors, blindness, and paralysis. And if syphilis goes left untreated, it can ultimately end in death as well. So the good news about all of these STIs, chlamydia, gonorrhea, and syphilis, is that they are all easily treatable. So if you are tested by your provider and you test positive for any of these STIs, they're all treated with antibiotics. And with all of these, you shouldn't have sex until the treatment is completed, or for chlamydia and gonorrhea, for at least 7 days after starting the medication. And the biggest thing to remember with STI treatment is that your partner needs to be treated too. Whether or not your partner is having symptoms, they need to be treated for the STI as well. And whenever your partner is receiving treatments, you still should not have any sexual activity for at least 7 days after starting the medication. So the best news is that STIs are preventable. If you're having any type of sexual activity, a barrier method is a very easy form of protection that you can use. And those are things like condoms, which are placed over the penis, internal condoms, which are inserted into the vagina, or dental dams, which are placed over the vagina. It's also really important when we talk about STI prevention to talk about STI testing. So if you have any of these symptoms, you should immediately get tested for STIs. You also should talk with your provider to find a regular schedule that's best for you to get tested for STIs. Also, if you get a new partner, both you and your partner should be tested for STIs before having any type of sexual activity. So lastly, I'm going to leave you with a couple of resources that you can look at if you need further information or if you have any questions that are left unanswered. And those websites are the Planned Parenthood website and the Centers for Disease Control and Prevention, or CDC website. And both of these have a lot of really great information about not just the STIs, what we talked about today, but all of the STIs. And it talks about prevention, treatment, symptoms, any questions that you might have about STIs and sexual activity in general. So at this point, I would encourage you to go back and take that pre-test that you took in the beginning of the presentation to give yourself a check on learning and to see what you learned during this presentation. Also know that I'm going to link these resources below in the description box so that you have easy access to them. I really hope that you enjoyed this presentation, and I hope that you learned something today. Thank you.